Hello, my name is Bill Hardiman. I'm the state senator from the 29th district, which includes the cities of Grand Rapids, Kentwood, and Lowell, and the townships of Cascade, Lowell, Virginia, and Groton. I'm very pleased to be here today. This is From Capital to Community. We'd like to talk about issues that are very important to all of us in the community. We've had a lot of great programs, very informative programs, and this one will be as well. I have a wonderful guest who's going to help us talk about issues related to long-term care. My guest today is Lisa Wendt she's the CEO of LifeSource. Lisa, thank you very much for joining us today. Great to have you here.
Thank you, and we're really happy to be here and appreciate the opportunity to talk about this very important topic. Absolutely.
Can you tell us, first of all, what is LifeSource, and then let's talk a little bit about long-term care.
Okay, LifeSecure is an insurance company that is a subsidiary of Blue Cross Blue Shield. We just formed in 2007, and for the purpose of providing long-term care solutions to Michiganders and in states beyond.
Well, Lisa, already you can see that I tried to change the name of your company. Forgive me for doing that.
Okay.
It's LifeSecure,
Yes.
And so thank you very much.
Sure.
And so 2007, so you're pretty new.
Mm-hmm. Yes, we are. We're happy to say that we've done a lot of expansion and work, and we've been able to provide really competitive insurance products in the city. But we've also been very active in Michigan in terms of trying to raise awareness of long-term care and the issues, particularly working with the state on partnership programs, long-term care awareness week, and things of that nature.
Wonderful, wonderful. Well, you're new, but long-term care and its corresponding insurance protection is relatively new to a new concept to many Michigan residents. So I'm very pleased to have you here so we can talk about it a little bit. And could you kind of explain it?
This is long-term care insurance is probably the worst understood type of insurance, and an issue that is really facing all of us. What it is not care that is provided in an acute situation. People seem to get it mixed up with a health incident, and it's really about having custodial care. When you typically we think about it in terms of activities of daily living when you're not able to care for yourself, and the activities are typically eating, bathing, dressing, transferring, continence, and cognitive and things of the like. And so again, there is no coverage other than long-term care for a custodial type of circumstance.
Well, it seems to make a lot of sense to have that kind of coverage because many people are living much longer, it seems nowadays. And so you've talked about kind of the kind of insurance it is. Who should be interested in this insurance, and when should they start to save for that?
Well, everybody should be interested in this product. Unfortunately, it's just not well understood. There is really a 1 in 2 chance that somebody over age 65 will need some form of long-term care insurance. And when you think about other insurance products, there's a lot, like fire or auto, which everybody's very familiar with. There's really under 1% chance that you'll ever get into a serious fire or auto accident circumstance, and yet we cover this readily. And so I think, really, when you think about retirement and planning for your future and how you're going to cover your costs of the inevitable, I think, again, planning with your family and planning early on is very important.
So what it really is it means that someone will help you live in the future, and when perhaps you're not able to provide the best care for yourself. Well, that makes sense, and you're right. When you think of it, we do buy all kinds of insurance for things that we have much less percentage of experiencing. But most folks hope that they're going to experience life after, 65?
Right.
Well, I have to tell you, Lisa, I used to think that was a long, long way away, and it's getting closer and closer for all of us, I suppose. Not for you, but for me. But I mean, everyone is moving in that direction.
Absolutely.
Now, some people believe that they don't need this. They'll be able to rely on Medicare and Medicaid, and that will take care of their long-term care expenses. Is that true?
That is true. That's probably one of the biggest misperceptions, that Medicare will provide some kind of custodial care, and it does to a degree. Once you have an acute incident, it will pay for a certain number of days, up to 100, really depending on the type of incident, for that custodial portion, but nothing thereafter. So it's really meant for acute care recovery. It's not meant for a long-term debilitating or just the outcome of aging in terms of becoming a frail elder and needing support. So it really doesn't cover that at all. And again, with the 1 in 2 probability that you will need this kind of care, and then the cost of care, I mean, this is something, again, that really needs to be looked at with respect to protecting yourself.
Now you say it's 1 in 2, so does that mean that there's only a 50% chance that folks will live beyond 65, or there's a 50% chance that they'll need some type of long-term assistance after age 65?
There's a 50% chance that someone after the age of 65 will need long-term care.
Okay.
That increases dramatically. It's something in the 90s for somebody age 85 and over. Okay. And for a couple, when you look at a couple, it's about 75% for a couple age 65 and above that one of the two will need long-term care.
Well, interesting. Now, for someone that's very young, they're probably thinking, I'm not even considering that. Plus, I'm going to stay very healthy, and I'm just not going to need any long-term care. What would you say to that person?
Well, I think I would say that it's really important to really understand that you can go through your retirement assets very quickly when it comes to a long-term care circumstance. We're not even just talking about nursing home health care, for example, assisted living, all of these facilities. Costs for home health care are rising. The hourly rate is rising from, say, 17 to 25 in some settings. And as the boomers grow and become to demand more and more of these types of services, I'm sure the price would inflate even, to a much greater degree. So you can go through your assets. An individual, say, with a $500,000 pool of money that they're going to retire on, based on the function of what their interest rate assumption is and what money they need to live is, you can spend down those assets in 5 years very easily, down to nothing. So when you retire, you think about saving money to retire and live comfortably or reasonably. If you have the shock of a long-term care circumstance, and again, it doesn't have to be in a nursing home, this can be devastating to your retirement and to your future.
Well, that's interesting, because we know that most people start saving for retirement at a very early age, and that's a good thing. But I think you pointed out that long-term care is kind of that ongoing kind of care. Medicare would provide for an acute type of need. So this is very important, and it's important to think about as well. Given the current economic recession and its impact on Michigan families, many people think they simply can't afford long-term care insurance, or that their spouse or children will take care of them. Indeed, I suppose in many years gone by, family did kind of take care of those who were older. What would you say to them?
Well, that's very true, and again, most of the caregiving is done by the family early on, and the thing is, it really takes a big toll, and people don't understand what caregiving really means as your loved one ages even more, and it's quite devastating to the family in terms of what the caregiver of the family is giving up, and providing the care as they as they need more and more care. Often there's circumstances where they have to go with their job or move in with a parent and those types of things. So they are providing the care, but if they had only planned, and often, one of the biggest moments, when the aha moment, if you will, for consumers to think about long-term care insurance is when they're giving care to someone. They suddenly see, oh my gosh, what's going to happen to me, and they see that they have this kind of work ahead of them. So, if you plan ahead and purchase long-term care, it is a level premium, age-based product, meaning that obviously, the earlier you sign up for long-term care insurance, say in your 40s when you're thinking about retirement,